Thank you for staying with me on TMI Tuesday as we look at the issues about the coronavirus scare, otherwise known as COVID-19. And just as it came upon us by the Italian from Milan on February 24th, the issues about how it's really hitting the Nigerian polity and the reactions, the ripples that is being caused as a result of this arrival of the disease in Nigeria. The sub-Sahara part of Africa is really hitting waves. And discussing this with me, how to wrap our heads around the subject in order to tackle it, I have a consultant, clinician, hematologist on infectious diseases, University of Benin Teaching Hospital, Dr. Benson Okwara. Thank you for coming, Doctor.
It's my pleasure.
Will it be wrong for me to have a handshake with you?
It's okay. Yeah, you're protected.
All right, so
we
look at this outbreak, and it was like a nightmare when it came upon us like a hurricane. That the first case has been recorded in Nigeria as it hits Lagos by the Italian. Now, what great dangers does this pose?
Coronavirus disease is, as the name implies, a viral infection that affects largely the respiratory tract. And because of the potential for human-to-human transmission and the rapidity with which it can actually be transmitted, we should be a little bit worried, particularly if we make reference to the way it started in China and the numbers that are affected at this time. So there will be some cause for concern. However, I think there was enough time for Nigeria to actually be ready. Peradventure, we have a case. Putting things in place, the hand hygiene campaign that we've always been talking about everywhere. So if we maintain the basic stuff, I'll call it, hand hygiene, hand wash, make sure you do everything you need to do as a human to protect yourself and even to protect others, particularly in healthcare facilities. I wouldn't think it should be a major issue. But if we are caught unawares, then that may pose the danger that you talk about.
Okay, on the papers this morning, we read a report where it said the federal government is unable, in its word, finding it difficult to trace 158 co-passengers of the Italian that came with it. Is that not another challenge?
Yes, it is. Because if you look at our country, we've always had this challenge of proper documentation. I can give you a scenario. Patients come to the hospital, UBTH, you ask them for their addresses, they give you the wrong information. You ask them for their phone numbers, they give you, it looks as if you're asking for this information to get back at them, and it's like they're defensive. They don't give you the right address, they don't give you the right phone number, and it becomes a challenge if there are issues and you need to trace these patients. So typically, I don't want to call it a Nigerian problem. It's a human problem, So I will not be surprised that even the forms, the contact tracing forms that were given to these individuals, they did not fill the right information. They may not have filled the right phone numbers. They may not have filled the right addresses. So definitely it will be difficult to trace everybody.
Okay. Let's look at the preparation, the facilities, for instance, and the aspect of this issue where government can trace the 158 co-passengers.
Yes.
As they go to different states, go to different cities, what's the worst case that could happen in terms of the present stance where some state governments are not even getting their facilities ready?
Yeah, I agree with you completely, particularly if for one reason or the other, maybe some of the contacts to the index case had actually acquired the infection. You cannot transmit if you're not infected. That is the truth. So for transmission to take place, it has to be the person is infected. So let us assume that there was no infection, of course, we won't have a transmission. But let's also assume that somehow, maybe one person may have contracted it. So there is a tendency that the person who probably goes to another state gets in contact with others, especially if the person who contracted it is beginning to have symptoms.
And yes, like again, they say that it doesn't come with symptoms immediately.
Yes, particularly over 80% of persons who acquire the infection may have mild or no symptoms at all. Okay?
Within a particular period of days, or
Not
what's the incubation period?
The incubation period is 14 days, okay, the maximum, but on the average about 5 to 6 days, 4, 5 to 6 days. But from the people who have been infected, who have been studied, they say the peak is about the 14th day. The study is still ongoing to know whether that's the accurate figure, but for now it's about 14 days. So 1 to 14 days, and initially the person may not have symptoms. Okay? The symptoms may occur maybe on the 12th day, maybe on the 13th day,
or maybe
on the 14th day.
So which means that again gives us a challenge whereby you isolate some persons for observation for a period of 2 weeks.
Yes, absolutely.
Is it not also possible that it could also exceed 14 days?
The possibility is there.
Because it's a novel virus.
Yes, it is.
Novel coronavirus.
Absolutely. Because it's a new virus, it's a new type of coronavirus. Yeah. We've always had coronavirus with us, but this is new. This is new.
We've always had coronavirus with us.
Yes, we've always had coronavirus. There are different types of coronaviruses. We've always had coronaviruses. As far back as 1937 in birds, in the poultry, for human coronavirus, as far back as 1960. The common cold we have, you have catarrh, you have cough, it's prevalent, particularly during the cold weather or during the dusty weather. Some of them are caused by coronavirus.
Okay.
But it's different from the one that is causing COVID-19.
Okay, that's why it's codified.
That's why new. Yeah, that's why it's, and it's new.
Okay.
Yes, it's a new type of coronavirus.
Okay. Let's look at, you are a consultant, a clinician,
yes,
dermatologist, University of Benin Teaching Hospital, in charge of infectious diseases.
Yes.
Can we say Edo State is ready in case anything happens in respect of this outbreak?
Oh, absolutely. I was discussing with you before the program went on air that the state government has a wonderful isolation center at the Stella Obasanjo Hospital for Women and Children.
Okay. Speak?
Yes. Wonderful facility.
The capacity of the number it can take?
12 bedded for now.
12 beds?
Yes.
For now?
Yes. Now, we had a meeting yesterday with the Chief Medical Director of University of Benin Teaching Hospital, Professor Obaseki, and it's clear in my mind that the state is willing to do everything possible to stem the tide. Peradventure.
Of course, because
we have, yes, absolutely. So I understand the facility is great. They have a separate generator. They have, it's ready to go.
Okay, but you said 12 beds.
Yes.
That's far below expectation, because if you want to measure the greatness of a facility, it's measuring because you're going to be isolating in case.
Yes.
For persons who, in the course of 2 weeks, could show a sign. And 12 beds is far below number. What do you think?
No, basically that facility will largely be used for those who have been confirmed.
Okay, positive.
Not really to, absolutely what the best thing to be done epidemiologically is when you contact trace people, you advise that they stay at home, but you need to enforce that, you need to monitor that. For any form of respiratory illness, the advice is stay at home.
But not for this novel kind.
Even for novel kinds.
Because in the course of staying at home, because it comes without symptoms. In the course of staying at home, others could also contract it. Oh,
staying at home does not mean you mix up with every member of the family. Even staying at home has its own restrictions, particularly if you are a high risk. What I mean, a probable case, maybe the contact is, you've had contact with somebody who has been confirmed, or maybe you've traveled to those countries who have high infection rates as we speak. So, because that facility will not be able to accommodate all persons who probably have listed on the contact tracing line and all of that. So advisory will always be that stay at home
until
as much as possible. Of course, there will be health facilities, health officers who will be monitoring that. Okay, of course, it's for a period of 14 days. The staying at home does not mean you're already confirmed. It's just that probably you've had contact and you'll be monitored for 14 days. The same thing is done even for Lassa. As we speak right now, we have Lassa.
Okay, sorry to cut in, but that's not the case where we had cases where in Ogun State, those who who were in contact with this Italian man, they were isolated. They weren't told to stay at home. So, if we are saying that now, is that not a different narrative?
No, it's not a different narrative. Remember, there was a diagnosis. In this case, the Ogun State case. So it is probable that the risk is there because there was contact in a confirmed case. Now we are talking about staying at home for people who have symptoms that looks like it, but have not had any travel to those areas, have not had any contact with confirmed cases. So because common cold can present just like coronavirus, so the advice will be stay at home until we're sure this is not coronavirus. Okay. For the other case, remember there was a diagnosis. If, for instance, I have had contact with a confirmed case, the true thing, the ideal thing would be to isolate me in probably a health facility or a facility provided by maybe the hospital or the government, because I've had contact with a confirmed case. What I was talking about is when people have symptoms. For instance, people come to UBTH, for instance, with fever, they have cough, they have respiratory difficulty. You must have the high index of suspicion. Okay? In that kind of case, you can isolate and watch. Those kind of cases. But if you exclude any contact with person who has had the disease or has had to travel and all that, if you give the initial treatment, you can say, okay, you can go home, we will monitor the situation from there. So that's the difference in there.
If you're just joining me, as TMI Tuesday, and I'm on the coronavirus scare, and I've been having a chat with Dr. Benson Okwara, who is a clinician, consultant, and dermatologist, infectious diseases in the University of Benin Teaching Hospital. Well, our social media platforms go, and you can ask questions relating to this issue, and as much as we get it on our handle, we will be also asking the doctor in this respect. But let's come to issues about prevention. Now, there's this great aspect where they said, well, face masks or nose masks could also be a way out in terms of when you are going out to put it on. But well, as we can see in Edo State, that's a scarce commodity. But do you advise that at this point we can be using that even in the state?
The Center for Disease Control does not even support the use of face mask for persons who do not have symptoms. The reason is simple. If we look at the way the virus is actually transmitted, yes, people who are coughing, sneezing, and all of that, when they sneeze or when they cough, they transmit or they expel these viruses in form of droplets or fomites. Okay. Now, traditionally, somebody who is coughing, there's a tendency for the normal human reaction to be give a distance, right? Yeah. They advise that. For someone who has symptoms, they say, okay, give at least 5 to 6 feet, about 1.5 meters from the person. The virus can only go as far. So you're okay on that. The issue of face mask, if you don't have symptoms, remember that there is also the possibility of transmission from the hand. You know, yes, because maybe somebody who has coughed on the surface and you put your hand there, and you know we have this way of putting our hand on our face. Now, look at where the face mask issue becomes a problem. I don't have symptoms, I put on a face mask. There is a tendency for me to adjust the face mask. Now my hand goes to my face. I don't know what I have touched. So hand washing is even more preventive, cheaper, more than even using the face mask. Face mask is very valuable for those who are symptomatic, who are coughing, right? So that they do not spread the droplets. So I wouldn't advise, CDC is not advising those who do not have symptoms to use face mask.
Okay.
Because you have to go to your face to adjust and all of that, and you don't know what you have touched.
Okay. So for now, we still stick to regular
hand washing, alcohol, hand rub, yes.
Hand sanitizers.
Absolutely.
You may mention alcohol.
Yes, alcohol hand rub. You know, most of these hand sanitizers contain alcohol. Alcohol is very effective in killing the virus. If it contains 60% or so alcohol in the hand rub, apply it and you're good. Okay. However, if your hand is soiled, obviously you have to wash before you can start to use alcohol hand rub.
Okay, that brings us to the point where some are saying that chloroquine phosphate has been identified as an antidote to the novel virus, coronavirus.
I read that article, I think sometime, a couple of days ago. Okay. One of the colleagues put it up on our doctor's blog, and I went through it. It's not verified.
It's not verified.
Yes. Probably, you know, a lot of science goes into when new diseases come up, and people try a lot of things. They get the organism in the laboratory, try to use some medications to see whether it can suppress it, but it has not been proven. Yes.
Okay. What about the use of Dettol? Because on the papers today, we also saw reports where persons were thinking that Dettol is also advised.
Well, what does Dettol contain? The issue, is it Dettol to wash your hands with, or to wash your clothes with, or
the virus?
Do you understand? So, but the basic thing, like I said, hand wash.
Okay.
Alcohol hand rub, very effective. They're even talking about Dettol. Things as simple as bleach. Okay. There's a concentration of bleach you can add in whatever you're treating, your equipment, and the virus goes. Okay? So instead of Dettol, why don't you use bleach if you have to disinfect your instruments or your stuff, or to even clean your household? Those ones are even more effective and has been proven, you know, to kill the virus. Okay. You know, chloroquine, Dettol, I'm not sure.
They are not very vital.
Yes.
Okay, let's look at this aspect of sport activities. We know how sports unify everyone, and it's a global way of uniting the people of the globe. Now, we have a very important sport activity that will be converging on Edo State, the Edo National Sports Festival. Now, look at this. There's this challenge that now that we are trying to find a handle in containing the outbreak in Nigeria, bringing it to Edo State, hosting the National Sports Festival, will not be a huge threat, because the federal government, like reports having today, that they say they are not postponing the festival. But some are saying that for this sake, it should be postponed. What's your view there?
Well, I'll give what looks like a more scientific view, okay, rather than a personal view. For now, we only have one case confirmed. Okay? The index case is still undergoing treatment. Well, the report we have is that it's not it didn't have serious symptoms.
Yeah, and it's getting better.
And it's getting much better. So we have just one case. Now the question is that sufficient to cancel a sports festival? No. However, it is sufficient to put everything in place to ensure, yes, that every single athlete or official that comes into Edo State is closely monitored, is closely screened, thermometer, the infrared thermometer, okay, to check the temperature of such individual. Yes, and symptoms. If anybody comes in and has fever, the person has to be put aside. If anybody comes in and has cough and has difficulty with breathing, the person has to be put aside. Okay? So, I've answered it, just one case. If we had maybe many more cases, then it may be sufficient enough. Okay. But just one case, I don't think so. Okay. But we need to put our guards.
In the direction of the state government, you did mention that isolation center at Stella Bashanger Hospital.
Yes.
Can't we have one at University of Meditation Hospital?
Oh, absolutely. In fact, even before the issue of coronavirus, there have been plans to build a well, a state of the art, if I may put it, because I was part of those who came up with the template, the diagram with the engineers, with the quantity surveyors in UBTH.
And this was?
This was late last year.
Okay.
Late last year. Of course, it was preparatory even towards Lassa fever.
Okay.
But it could serve those multi-purposes for infectious diseases.
Of course, yes.
Okay, so it's going to be huge. I know the plan is still on. It was prepared towards, of course, that was even before the COVID-19 came on board. So it's still on. Definitely UBTH will have one. Definitely, I'm certain about that. But in the interim, there is a building we have, which we have been using for now for infectious diseases. But we're trying to come up with, readjusting the building so that it will be easy for patient inflow and outflow.
Okay.
So there is a structure on ground. It's not fully the ideal, but I'm sure UBTH has serious plans. As I told you, the plan has been drawn. It's just, where's the money? And it's up.
Like it's commonly said, we will get there.
We will definitely build it.
And
yes, the plan is there. Yes, absolutely.
Okay.
It's
Thank you very much,
working.
Dr. Benson Okwara,
It's a
for
pleasure.
finding time to be part of this
Thank
show.
you.
Well, with this, we'll call it a wrap on this segment, but don't forget that we'll also be looking at the economic implications of the coronavirus scare, otherwise known as COVID-19 in Nigeria. What implications is going to be having. We'll be discussing with a public affairs analyst and, of course, an economic expert in this. Don't you go away.